Today we will discuss renal calculi, commonly known as kidney stones. Renal calculi are also called nephrolithiasis or urolithiasis. These stones form when minerals and salts accumulate within the kidneys or urinary tract. Stones can become lodged anywhere along the urinary tract and may cause severe pain, obstruction of urine flow, and blood in the urine. A key concept for nursing students to remember is that although kidney stones are extremely painful, approximately 80 to 90% of stones will pass spontaneously through the urinary tract without surgical intervention. Renal calculi develop when minerals and salts become concentrated within the urine and crystallize. Over time, these crystals combine and form stones. Several types of stones can develop. Calcium stones are the most common. Urine pH influences stone formation. When urine becomes highly concentrated due to dehydration, minerals have a greater opportunity to crystallize. As stones travel through the ureter, they can scrape the lining of the urinary tract, causing bleeding and severe pain. If a stone becomes lodged, it may obstruct urine flow, causing pressure to build within the kidney. Several factors contribute to kidney stone formation. The most important risk factor is inadequate hydration. When fluid intake is low, urine becomes concentrated, allowing minerals to crystallize. Other risk factors include high sodium intake, high protein diets, excess calcium intake, genetic predisposition, sedentary lifestyle, hot climates, frequent dehydration, hyperparathyroidism. Environmental and lifestyle factors play a major role. Individuals who work outdoors, exercise heavily without replacing fluids, or live in warmer climates are at increased risk. Several chronic conditions increase the risk of developing renal calculi. These include hypertension, chronic kidney disease, type 2 diabetes mellitus, hyperparathyroidism, recurrent urinary tract infections. These conditions may alter urine composition, affect kidney function, or increase mineral accumulation, leading to stone formation. Nurses should assess clients for these underlying conditions when caring for patients with renal calculi. Kidney stones occur worldwide, but are more common in certain geographic regions. Areas with higher temperatures tend to have higher rates of stone formation because individuals lose more fluid through perspiration and may become dehydrated. Regions with increased incidence include southern United States, Europe, parts of Asia, Greenland, Australia. The relationship between climate and hydration makes prevention education extremely important. Renal calculi can significantly affect both physical and emotional health. Physiologically, kidney stones can cause severe pain, urinary obstruction, infection, nausea, vomiting, and impaired kidney function. Psychosocially, the sudden onset of severe pain often creates anxiety and fear. Many clients describe renal colic as one of the most painful experiences they have ever had. Physical activity without adequate hydration increases the risk of stone formation and recurrence. Older adults account for approximately 10 to 12% of individuals with renal calculi. Age-related factors that increase risk include reduced fluid intake, poor dietary habits, decreased mobility, chronic illnesses, multiple medications. Older adults may not recognize dehydration as quickly and often consume less water throughout the day. This makes prevention and hydration education especially important in this population. The hallmark symptom of renal calculi is sudden severe flank pain. Pain typically begins abruptly and may radiate toward the groin, testicle, scrotum, or labia as the stone moves through the ureter. Additional manifestations include hematuria, nausea, vomiting, restlessness, urinary urgency, urinary frequency, fever, chills. Fever and chills are especially concerning because they may indicate infection and obstruction occurring simultaneously. This is considered a medical emergency. One of the most important nursing concepts is understanding urinary obstruction. When a stone becomes lodged, urine can no longer flow normally through the urinary tract. This obstruction increases pressure within the kidney, causing severe pain and potentially damaging kidney tissue. Prompt identification and treatment are necessary to restore urine flow, relieve pain, and preserve kidney function. Several diagnostic tests help identify kidney stones. A KUB X-ray evaluates the kidneys, ureters, and bladder, but may miss smaller stones. Ultrasound helps identify urinary obstruction and hydronephrosis. The gold standard diagnostic test is a non-contrast CT scan of the abdomen and pelvis. This is considered the most reliable imaging study for identifying stones. Contrast dye is generally avoided because it may further damage compromised kidneys. Urinalysis often reveals hematuria and may show infection. Nurses play a critical role in both acute treatment and prevention. Responsibilities include pain assessment and management, monitoring hydration status, encouraging fluid intake, monitoring urine output, straining urine for stone collection, monitoring for signs of infection, providing patient education. Patient compliance with long-term lifestyle changes is essential for preventing recurrence. During an acute episode, patients should be instructed to strain all urine to capture any stones that pass. After recovery, education focuses on preventing future stones. Teaching includes increasing water intake, limiting sodium intake, reducing excessive protein intake, following prescribed dietary modifications, maintaining physical activity, recognizing early symptoms of recurrence. Hydration remains the most effective preventive strategy. Treatment depends on the size and location of the stone. Many stones pass naturally with increased fluids and symptom management. Medications used to assist stone passage include tamsulosin, also known as Flomax, nifedipine, also known as Procardia, alfuzosin, also known as uroxetrol. These medications relax the smooth muscle of the ureter and improve the likelihood that the stone will pass spontaneously. Pain control and antiemetic therapy are frequently required. When stones do not pass naturally, procedural intervention may be necessary. Extracorporeal shockwave lithotripsy, or ESWL, uses shock waves to break stones into smaller fragments that can pass through the urinary tract. For lower ureter stones, ureteroscopy with laser lithotripsy may be performed. These procedures help eliminate obstruction and preserve kidney function. The first step of clinical judgment is recognizing cues. Important assessment findings include sudden severe flank pain, pain radiating to groin, hematuria, nausea and vomiting, fever, chills, restlessness, difficulty urinating. Students should ask themselves, what findings suggest renal calculi? What findings suggest complications? Next, analyze the cues. The pathophysiology explains the symptoms. The stone causes irritation, obstruction, inflammation, and increased pressure. Findings requiring immediate attention include fever, chills, signs of sepsis, decreased urine output, severe uncontrolled pain. Students should connect the symptoms to the underlying obstruction. The priority problems include acute pain, fluid volume deficit, urinary obstruction, infection, impaired renal function. The highest priority patient is the client with an obstructing stone accompanied by fever, chills, and decreased urine output. This combination suggests infection and obstruction, which can rapidly become life-threatening. Interdisciplinary team members may include urologist, radiologist, registered nurse, pharmacist. Planning focuses on relieving symptoms and resolving obstruction. Goals include adequate pain control, hydration, stone passage, infection prevention, preservation of kidney function. Expected outcomes include pain reduction, improved urine. output, passage of stone, absence of infection, stable renal function. Implementation includes administering analgesics, administering antiemetics, encouraging hydration, straining urine, monitoring intake and output, monitoring vital signs, administering prescribed medications, preparing for procedures if needed. Documentation should include pain levels, urine output, presence of stones, medication response, patient education. Evaluation determines whether the interventions were successful. Desired outcomes include stone passage, resolution of pain, improved urine flow, absence of infection, stable kidney function. If goals are not achieved, the plan of care must be reassessed and modified. The nurse continuously evaluates the patient's response and collaborates with the healthcare team to ensure optimal outcomes. Remember this NCLEX Pearl: a patient with a kidney stone who develops fever, chills, decreased urine output, or signs of sepsis is experiencing a potential urinary obstruction with infection. This is a priority situation requiring immediate intervention because obstruction plus infection can rapidly lead to severe kidney damage and sepsis.